Hepatitis is a medical condition characterized by inflammation of the liver. The term hepatitis comes from the Greek words hepar, liver, and itis, inflammation. This inflammation can result from various causes, including viral infections, alcohol use, toxins, autoimmune diseases, medications, and metabolic disorders. The liver, a vital organ, performs many essential functions such as detoxification, protein synthesis, and the production of biochemicals necessary for digestion. When the liver is inflamed, these functions can be impaired, leading to a wide range of health issues. Types of hepatitis. The most common and significant forms of hepatitis are viral hepatitis types A, B, C, D, and E. Each is caused by a different virus, with varying modes of transmission, severity, and outcomes. Hepatitis A, HAV. Hepatitis A is primarily transmitted through the fecal-oral route, often by ingestion of contaminated food or water. It is more common in areas with poor sanitation. Hepatitis A usually causes an acute infection with symptoms like jaundice, yellowing of the skin and eyes, fatigue, abdominal pain, nausea, and fever. It does not cause chronic liver disease and typically resolves on its own within a few weeks to months. A vaccine is available and widely used for prevention. Hepatitis B, HBV. Hepatitis B is transmitted through exposure to infected blood, semen, or other bodily fluids. Common routes include sexual contact, sharing needles, and from mother to child during childbirth. Unlike hepatitis A, HBV can cause both acute and chronic infections. Chronic hepatitis B can lead to serious complications such as cirrhosis, scarring of the liver, liver failure, and hepatocellular carcinoma, liver cancer. Vaccination against HBV is highly effective and is part of routine immunization programs worldwide. Hepatitis C, HCV. Hepatitis C spreads mainly through blood-to-blood contact, commonly via sharing needles. Blood transfusions before screening was standard, and sometimes through sexual contact. Most people infected with HCV develop a chronic infection. Over time, chronic hepatitis C can cause progressive liver damage, cirrhosis, and liver cancer. There is currently no vaccine for hepatitis C, but modern antiviral treatments can cure most infections. Hepatitis D, HDV. Hepatitis D is a defective virus that requires the presence of hepatitis B virus to replicate. It is transmitted in the same way as HBV and can worsen the severity of hepatitis B infection, leading to more rapid progression to liver damage. Vaccination against hepatitis B indirectly protects against hepatitis D. Hepatitis E, HEV. Similar to hepatitis A, hepatitis E is transmitted via the fecal-oral route through contaminated water. It usually causes an acute, self-limiting infection but can be dangerous in pregnant women, where it carries a higher risk of severe disease and mortality. Vaccines exist but are not widely available. Causes beyond viruses. While viral hepatitis is the most well-known, liver inflammation can also arise from alcoholic hepatitis. Chronic heavy alcohol use can inflame and damage the liver. Autoimmune hepatitis, the immune system mistakenly attacks liver cells. Drug-induced hepatitis, certain medications and toxins can cause liver inflammation. Non-alcoholic steatohepatitis, NASH, part of the spectrum of fatty liver disease. NASH involves liver inflammation and damage due to fat accumulation, often linked to obesity and diabetes. Symptoms of hepatitis. Symptoms vary depending on the type and severity but often include fatigue and weakness, loss of appetite, nausea and vomiting, abdominal pain or discomfort, especially near the liver, right upper abdomen, dark urine and pale stool, jaundice, yellowing of the skin and eyes, fever and joint pain, more common in viral hepatitis. In many cases, especially chronic hepatitis, symptoms may be mild or absent for years until significant liver damage occurs. Diagnosis. Diagnosis begins with a detailed history and physical examination, focusing on risk factors such as travel, drug use, sexual history, and vaccination status. Laboratory tests include liver function tests. LFTs measure liver enzymes like ALT and AST that rise with liver injury. Serologic tests identify viral antigens, antibodies, or viral RNA/DNA to detect specific hepatitis viruses. Imaging, ultrasound or CT scans may assess liver size, texture, and complications like cirrhosis. Liver biopsy, occasionally performed to evaluate the extent of liver damage. Treatment. Treatment depends on the type of hepatitis. Hepatitis A and E usually require supportive care, hydration, rest, nutrition, since they are self-limited. Hepatitis B, antiviral medications like tenofovir and entecavir can control viral replication and reduce liver damage but usually do not cure the disease. Hepatitis C, direct-acting antivirals, DAAs, have revolutionized treatment, curing over 95% of cases. Hepatitis D, treatment is complex, often involving interferon therapy alongside hepatitis B management. Non-viral hepatitis, management focuses on eliminating the cause, example alcohol cessation, immunosuppressants for autoimmune hepatitis. Prevention. Vaccination, highly effective vaccines exist for hepatitis A and B. Safe practices, using clean needles, practicing safe sex, screening blood products, and improving sanitation reduce transmission. Healthy lifestyle, avoiding excessive alcohol, maintaining a healthy weight, and being cautious with medications support liver health. Complications. Untreated chronic hepatitis can lead to cirrhosis, permanent scarring and loss of liver function. Liver failure, the liver cannot perform essential functions, requiring transplantation. Liver cancer, hepatocellular carcinoma is a major risk in chronic HBV and HCV infection. Extrahepatic issues, some hepatitis viruses may affect kidneys, blood vessels, or cause systemic symptoms. Global impact. Hepatitis remains a major global health problem. According to the World Health Organization, WHO, around 296 million people were living with chronic hepatitis B infection in 2019, and 58 million with hepatitis C together. Viral hepatitis causes about 1.1 million deaths annually, mostly due to cirrhosis and liver cancer. Efforts such as global vaccination programs, improved screening, and access to antiviral treatments are key to reducing this burden. Summary. Hepatitis is an inflammation of the liver caused primarily by 5 viruses, A, B, C, D, and E, each with different transmission routes and outcomes. Beyond viruses, alcohol, autoimmune disease, and toxins can cause hepatitis. Symptoms range from mild to severe and can lead to chronic liver disease if untreated. Vaccination, safe health practices, early diagnosis, and effective treatments are essential tools in managing and preventing hepatitis. With continued medical advances and public health efforts, many forms of hepatitis can be controlled or cured, improving outcomes and quality of life worldwide.